that were developed, and they are developed along who is most likely to be infected. So, for instance, healthcare workers are much more likely to get these high viral loads of COVID-19 than your normal construction worker. Those that are 75 years of age and older, and those that are in long-term care facilities are much more likely to die of COVID-19. So why do we still have the eligibility requirements that we have versus what CDC has, for instance, at 65 and older? Or why aren't we doing what Mississippi's doing or Florida's doing, et cetera, fill in the blank? So all of these situations are local, meaning the policies that are established in Alabama are directly related to vaccine availability and who has been vaccinated to date. So currently, we are still in phase 1A. That is healthcare workers and those that are in long-term care facilities. Governor Ivey extended that eligibility in the state of Alabama to include those 75 years of age and older and first responders. We are still in the process of vaccinating these groups. So as soon as Alabama Department of Public Health opens up eligibility standards to include other demographics, we will then start vaccinating those individuals. The situation is different in Mississippi due to declines in vaccine. It's different in Florida due to distribution of hospitals and the distribution of Pfizer and Moderna. So I think those were the two questions that we get quite a bit. So let me give you a little bit of background on our vaccination clinic yesterday. This occurred at the cruise terminal. Mobile Police Department and the staff at the Mobile, Alabama cruise terminal handled over 700 cars and nearly 1,300 people. We were able to deliver nearly 900 vaccinations. Most of them were prime, meaning first dose. We had about 20 second doses that were delivered yesterday. We utilized 51 wheelchairs, 2 golf carts. We handled approximately 50 individuals that needed considerable assistance from their vehicles. We did have to defer around 10 individuals who were presenting for vaccination and were not eligible. We turned them away at the entry point. And we did have 3 that were medically ineligible to receive the vaccine. So to be medically ineligible to receive the vaccine means that you have had another vaccination in the last 14 days, or you've had monoclonal antibody treatment for COVID-19 or convalescent plasma for COVID-19 in the last 90 days. So we did have a couple of individuals who met those criteria, and we could not vaccinate them. So I want to share with you some additional news with respect to upcoming vaccination clinics. So tomorrow, January 29th, we will be conducting a second dose or a booster dose at the Mobile, Alabama cruise terminal. These will be for individuals who have been vaccinated by Mobile County Health Department between December 28th and December 31st. The reason that we make that criteria is if you received your vaccination at a hospital, for instance, you very likely received the Pfizer dose. We cannot provide you the Pfizer vaccine. We give Moderna, and you cannot intermix those two. So only those that were vaccinated by the Mobile County Health Department between December 28th and December 31st will be vaccinated tomorrow with their boosters. For those of you that fit that criteria, please bring your CDC vaccination card that you received at checkout. I also just want to make a quick comment. There is a propensity for people to queue very early in the morning for vaccinations when we do our big vaccination events, as well as the smaller booster vaccination event tomorrow. You do not need to do that. We clear that queue in about an hour to an hour and a half. So to sit in line in your car for 3 hours waiting for us to open the cruise terminal, it's your choice. But if you come around 11:30 or 1:30, you'll park, you'll walk right in, and you'll be in and out in less than an hour. So I would just caution you about trying to get here the day before or at 3 a.m. to be vaccinated. You do not need to do that. So that's our booster clinic for tomorrow. We're also announcing primary vaccinations in 3 of our outlying clinics. So the focus, both for many of the hospitals and as well as Mobile County Health Department, has been very centered around the city of Mobile. So on Tuesday, February 2nd, we will be conducting a first dose vaccination clinic at our Sims Family Health location. This will run from 9 a.m. until 2 p.m. We will enforce the current eligibility requirements as set forth by Alabama Department of Public Health. So if you're 50 years of age and have 3 comorbidities, we will not vaccinate you until Alabama Department of Public Health changes those criteria. So that's our vaccination clinic on Tuesday, February 2nd. On Thursday, February 4th, we will move to Centinel, and we will conduct a drive-through clinic from 9 a.m. to 2 p.m. as well. Same eligibility requirements are enforced. And then Saturday, February 6th, we will do an additional first dose vaccination clinic in the city of Mount Vernon. This will be at Bellsaw Middle School. This is at 1620 Gartman Circle. So we could not use our clinic in Mount Vernon due to the traffic flow. So we are moving it to the Bellsaw Middle School. All other vaccination clinics will be adjacent to our health clinics for Mobile County Health Department. We will be publishing maps early next week in terms of traffic flow. But again, all 3 of those clinics, the first dose clinics, run from 9 a.m. to 2 p.m. These are first dose only. They will all be drive-through